Health Watch 9, we take a closer look at a serious heart condition that can change lives: left-sided heart failure. It's a diagnosis that affects millions, often quietly at first, but with potential life-threatening consequences.
And I'm Nat. We'll explain what causes it, how it affects your entire body, the symptoms you shouldn't ignore, and what doctors look for during an exam. We'll also share the latest treatment options and prevention strategies. Today we have Dr. Roman Majors coming to us live from Stanford University. Thank you, Dr. Roman Majors, for being here with us
Thank you
tonight.
for having me. Never been on TV before.
Left-sided heart failure happens when the left ventricle, the heart's main pumping chamber, can't contract effectively. Instead of sending blood forward to the body, fluid backs up into the left atrium, then into the lungs, causing congestion.
Common causes include a heart attack that damages muscle tissue, high blood pressure that overworks the heart, and valve problems like stenosis or regurgitation. In advanced cases, fluid overload can cause pulmonary edema. And failure can even extend to the right side of the heart, causing a host of systemic issues, including pooling, swelling, and coolness of the extremities, enlargement of the liver and spleen, as well as distension of the jugular vein. These effects can be seen downstream following a number of years with this condition.
So chronic high blood pressure is going to be the leading cause of left ventricular failure. Over the years, high aortic forces really cause the heart to work much harder, and that thickens the muscle wall. Just like you go into the gym, you train your muscles and they get bigger, but with the heart, that we only want so much of that. And we get a process called hypertrophy, which is where the muscle gets much thicker than it needs to be. And that thickened wall needs more oxygen than the coronary arteries can deliver. And that thicker wall also has reduced flexibility, which makes the filling portion of the cardiac cycle, something that we call diastole, much less efficient. And eventually the heart just it can't fill properly. And this is what we would call a restrictive cardiomyopathy. The tissue becomes very stiff, and there's just not enough room for blood to fill and evacuate the ventricles. And it's a lot more prone to injury from reduced blood flow events such as an ischemic myocardial infarction or what you would call a heart attack.
Net effect? Through a combination of extra work, overt muscle growth, poor ventricular filling, and oxygenation that does not meet the needs of the tissue, a cascading chain reaction that takes place leading to reduced pumping ability, which sets the stage for heart failure. As you can see, there are a number of factors that contribute to left-sided heart failure, and it's something that degenerates over an extended period of time.
There are two main ways the left ventricle can fail. In systolic dysfunction, the pumping strength is reduced, sometimes due to ventricular dilation from overstretching of the cardiac tissue, which weakens its structure and makes it more difficult for it to squeeze tightly enough to pump blood through the pulmonary valve. In diastolic dysfunction, the heart muscle is too stiff to relax and fill properly, both leading to reduced cardiac output and similar symptoms.
So for anyone watching, just recognizing and catching those early symptoms is going to be critical to taking care of this. And the most common is orthopnea or shortness of breath when you're lying flat. And that's due to that fluid backup. And when you lie flat, you can think it's really because of gravity. Normally it'd pull down at your legs, but when you're lying flat, it sort of equalizes everywhere in the body, and that causes fluid to shift into the lungs. You may also experience paroxysmal nocturnal dyspnea, which is difficulty to breathe at nighttime. It's usually accompanied by waking suddenly at night, gasping for air. Some patients describe that as like a choking feeling, kind of like waking up from a nightmare. And this can occasionally be mistaken for an obstructive hypoapnea event or sleep apnea. So if you're experiencing something similar to this, I would very much recommend contacting your doctor and letting them know. Reduced blood flow to the brain that's caused by this can cause a whole host of issues, such as headaches, confusion, lethargy, memory loss, anxiety, or even trouble sleeping in the first place. Other signs include weakness, exercise intolerance, general muscle weakness. You may not pee as much. Your extremities may feel very cold to the touch, and you may have a persistent cough that's productive. Especially a red flag would be if it had a pink, frothy, sort of thick, mucusy texture to it. So definitely keep that in mind.
It started with being tired all the time. Then one night I woke up feeling like I couldn't breathe. That's when I went to the ER and found out it was my heart.
When the left ventricle fails, it's not just the lungs that suffer. The brain gets less blood, leading to mental changes. The kidneys lose perfusion, causing fluid buildup. The digestive system slows, leading to nausea and poor appetite. And the body's attempt to compensate through nerve signals and hormones involving both the kidneys and the sympathetic nervous system can actually make the heart failure worse.
That's really a domino effect. Once the heart can't keep up, every single system starts to feel the stress and the strain, and they all start to fail because nothing's getting enough blood. And remember that the heart supplies blood to itself via the coronary arteries, so the heart isn't even getting enough blood itself, and it's supposed to be pumping blood to every area of our body. And that really creates a cyclic effect where the heart becomes weaker and it doesn't pump as much blood and it doesn't pump as much blood to itself. So its weakness causes it to become even weaker, and it's just a vicious cycle.
Diagnosing left-sided heart failure starts with the patient's history: fatigue, waking, trouble sleeping, swelling, and shortness of breath. On exam, vital signs may show low blood pressure or poor oxygenation. Skin may appear bluish, lungs may have crackles from fluid, and the heart may produce extra sounds, S3 or S4, signaling abnormal filling or pressure. In severe cases, an enlarged heart can even shift the apical pulse further towards the side of the chest.
Treatment includes medications to lower blood pressure, remove excess fluid, and help the heart pump more efficiently. ACE inhibitors, beta blockers, and diuretics are common. Lifestyle changes, like reducing salt intake, staying active, and controlling blood pressure, are just as vital.
If you have high blood pressure, diabetes, or a history of heart disease, regular checkups can catch problems before they turn into heart failure.
And if you experience sudden shortness of breath at night, swelling, or unusual fatigue, don't wait. See your doctor immediately.
For Health Watch 9, I'm Bailey.
And I'm Nat. We would like to thank Dr. Roman Majors for joining us tonight again.
Yeah, thank you so much. I always have fun explaining this kind of stuff.
Stay informed and stay heart healthy.